guys!
Hi!
Welcome back to episode 12, and this week we're going to go through a little bit about pain relief in labour, our experiences, what we are open to try, what we feel isn't right for us. We won't go into all the nitty details, we'll leave that for Friday Facts, where we can be a bit more factual, and leave that then for you guys. If you want to know more information, you can go listen to that there. So let's just jump straight in. Let's go with what pain relief you had and how you found it.
Going straight in. I started off, so they didn't give me gas and air to start with, but I did have gas and air. I had the pethidine drip, not
injection
drip. Pain relief as well. I then had an epidural, so I've had the three. Couldn't tell really much.
Can you remember much from like your pain relief, in the sense that obviously we've talked about your labour in the past, and there's definitely some big moments that you remember from and what you find quite traumatic, but pain relief, do you really remember it? Like,
I don't remember feeling any different from having the pethidine. That's all I'd say. The pethidine.
Pethidine. I had that as well with Harper.
Yeah, I just don't feel like it relieved anything. If anything, I was just in and out of conscious. Well,
maybe that was the pethidine kind of working, and you've like put that memory to being like extremely tired. But that's normally why they give it to you.
Yeah, because they gave me a not a bedpan, like a sick bowl.
Yeah.
Sorry, guys. But just in case. And I just remember falling asleep and thinking this sick bowl that I was holding was like this really expensive fat, like jewel or something. And me and Josh were in Australia at this point in my head.
Oh my god! So you were super high, because it is an opioid.
So it's probably what it is.
It's probably all that memory of you being like, because I remember you saying how extremely tired you were, that you started like hallucinating type thing from that. But maybe it was just the good drugs they were.
Yeah, maybe, because I literally was just like falling asleep. I was like, oh my god, I've dropped it. I was just dropping the sick bowl, but I was like, Josh, we're in Australia. He's like,
g'day.
Yeah, he was like, we're not in Australia. But I just remember keep falling asleep, and this sick bowl was like this really expensive thing, and I kept waking up to dropping it. Yeah. Obviously I was falling asleep.
It's probably all the side effects then.
Yeah.
With pethidine, it's an injection they give you either into your butt cheek or your upper thigh.
Yeah.
And it lasts about 2 to 4 hours, and it is basically, they normally give it to you if labour's like just taking its time to progress and you're just getting super tired, and they normally give it to you like the middle stages of labour. They don't want to give it to you towards the end because it can affect baby. But it's an opioid, so that's those sort of things, and that feeling of being so tired, they're probably like, you do need a rest.
Yeah, you need to sleep for a little bit, because I kept just sleeping in and out, and then when it wore off, that's when it was like the oxytocin drip was just like sucker punched in my face.
Yeah, because I definitely, when I had the injection, it definitely like allowed me to sleep for maybe an hour or two, but as it started to wear off, I was still asleep and I could feel the contractions.
So it's pretty,
But I was lucky that it let me sleep and I didn't have any other side effects.
Luckily you got the sleep, because I think that's probably what it was. I was just sleeping, but I was so like, whoa, spaced out almost.
Whoa, dude.
Yeah, literally.
It's totally awesome.
What did you feel the injection when it went in?
I honestly cannot remember. I remember just waiting what felt like a lifetime, because I was on the midwife-led unit, so I don't know if it's different on the labour ward, but it meant a doctor had to come down and prescribe it or administrate it. I can't remember, but basically they needed a doctor, and that just seemed to take forever. I'm sure it would have been just the prescription side of things.
Yeah, I don't remember who did mine.
And because they did it in my butt cheek, so I was like doggy. Wow. So I don't know who stuck the needle in my butt. Like,
I keep thinking it's like one of the EpiPens, because they alongside the pethidine, they do sometimes give you a sickness injection.
Yeah,
so I
did have that. Yeah,
because they put mine in my thigh, and I don't know what they did first. I don't want to scare anyone saying this, but I was like, oh, it's not that bad. And then all of a sudden, the pethidine went in. I went, oh my god. God! I was on no gas and air at this point, so
Yeah.
this was all the beginning, obviously, of labour for me anyway.
And it's all pain threshold as well.
Yeah,
like,
I was probably. I literally was like, "Oh my God, I overreact, like I underreacted, like what is this?"
Yeah.
I was in so much
And I
like.
find like different. For me, like I know that I'm such a wimp with certain pains, and then other pains I'm like I sat through a few contractions, just easy breezy, and this is like 10 centimeters dilated, and I was like, and I could deal with that pain, but like if you poke me,
You're like, "Ow!" Yeah.
it is the most painful thing that I've ever experienced in my life, and I will cry. So it could just be that as well,
yeah.
that you just, that type of pain for you is just too much.
it was
'Cause
like-
I don't remember that.
Oh, see, mine was like
I'm not saying it didn't happen, but I don't remember
mine
it.
was like a burning pain.
I think they do say it can burn at like the injection site, don't they?
So that's probably what it was. But yeah, literally,
And
I
it
was
takes
like,
20 minutes to work as well. So like if you're not having any gas and
yeah.
air, you're taking that on with no pain relief.
Because I said to them, I was like, "Can we start using the gas?" And then they're like, "Oh, have you not? You started using it?" I
Oh,
was
that's so strange.
Yeah.
Here's an injection of opioids.
Yeah, but you haven't started.
But don't
using
take
it.
care of gas and air.
Yeah, because I remember the gas and air, because I had it after when I started, like when the pethidine was wearing off. That's when I started having the gas and air. It feels really backwards.
Yeah.
And I just remember going into a cloud every time I was breathing it. Maybe if you see this is my
Still
birth
like
story.
the mixture of
Yeah.
like the high.
But I think it's because the pain was just so it's really weird because looking back, I can't even describe that pain tube. It
No,
was like
I can't
all
either.
over all I can remember, it was all over my body and it just took over. But I can't describe what that pain felt like.
No, they say the body forgets pain on purpose.
That's probably why.
There's definitely some pains in my life that I remember, and labour is not one of those. And I think that is one because you're flooded with oxytocin afterwards, like when that baby's born. And I think your brain just kind of tricks you into telling you, "I'll be fine for the next one."
Yeah, because I'm literally like, yeah, I'll do it again, even though I'm like,
I'm like buzzing. I'm like, I cannot. I don't know how many times I've said to you, I'm so
Sorry.
excited for labour, and you're like, what? the-"
yeah, how are you that excited? But then, because I don't really remember it, that's probably why I'm a bit like apprehensive.
Yeah.
Like how
I
I remember the
remem-
bad stuff, if that makes sense, not
Yeah,
the great
that's
stuff.
same, like for me, like the two pains that I remember from labour is with Harper when I had the episiotomy. Oh, I nearly said it.
You did episiotomy.
There you go. I always get you to say it for
Yeah,
me.
episiotomy.
Yeah, and she just didn't put enough local anaesthetic in when. And I was like, no, I can feel that. And I
Making my-
remember that pain.
Like,
Well, I don't remember that pain now, but I did. I know that, like,
In
for
the moment,
I
yeah.
remembered it for at least 18 months afterwards. And then with Lily, the Ring of Fire, I remember that, but it wasn't super painful, but I do remember it burning and
Yeah.
that sensation. But again, like, I cannot remember what a contraction feels like. However, when I started getting contractions with Lily, I was like, oh yeah, this is exactly what they felt like.
You like remembered them.
So it comes back quick enough, but that interim period just tricks you into another pregnancy.
Because that's the thing, I don't remember contractions because I was in so much with the oxytocin drip. Obviously, when you are being induced, just in case people don't know, like obviously it progresses your labour quicker. Like it pumps you full of oxytocin to get you started and get you going into labour. So it's pretty intense if you don't have any
And
pain
it's
relief.
pushing your body beyond the realm of what your body would have done naturally.
Yeah, so like instead of going like from 1 to 10 in the space of like 6-7 hours, I went from 1 to 10 in like an hour and a half to out. Like it was very quick, if that makes sense. And I just didn't really know what pain relief to have. That's why I had the pethidine, hoping that would help. Obviously it did not help.
I had a friend who explained it in a really good way. She said that her midwife had told her, because she didn't expect it to be as painful as it was, that every woman has to go through that progress of getting from 1 to 10, and that pain is relatively comparable. Like obviously women deal with it differently, but that pain is still there, and most women go through it, like you said, over a course of 12 hours. You had to experience the same thing within 6, so of course it was a lot more intense.
Yeah, it was. Yeah, it's very intense. So I definitely, if you are being induced and that does get recommended to you to get the oxytocin drip, I just have a really conscious effort of thinking of what pain relief to have, because it is quite intense in your body.
And have that discussion at the same time that they're talking about possibility of induction as well.
Exactly, just to find out that information, because I was very much like, when they talk about it in the antenatal class, I was like, oh, that doesn't sound too bad. I could do this. My body could not do it, and I definitely wish I got the epidural back at the start. But I keep saying if you listen to my birth story, but basically when they eventually gave me the epidural, I don't remember any of it. I just remember being hunched over and that was it. And then I woke up laying flat on my bed.
Yeah.
So I couldn't really tell you what it was like getting the epidural itself, because I know obviously I couldn't feel any of it, because I don't want to say I was passed out, but I almost felt I was in a cloud. I was in my cloud on my little gas and air bubble. And then I woke up and I was like, oh, yeah, I can't feel my legs. And that's how I woke up, and I was like, oh, can't feel, and I could not feel any contraction.
Yeah.
So I literally went from this pain that I can't even remember to feeling nothing.
Yeah.
And it was really bizarre. And then when I started feeling some kind of, they're like, press the button. So I was like, because when you get an epidural, you have like a little button that keeps injecting it into you, and you have to do it when it beeps. Really confusing, because when you're
just to like top up,
keep doing that, that was a bit confusing, because they're like, have you pressed it? And I was like, well, no, like I can't focus on that and focus on what's going on.
You said two things, like literally in just talking about your epidural, that just worry me, like, and this, it just reminds me whilst we're doing this podcast, because you said you woke up, you couldn't remember anything, and then like you were left with the responsibility of pressing it, and then they're asking you, have you pressed it? And you're like, no, like, and confused really what you're meant to be doing. And that just screams to me like lack of consent. And what I mean by lack of consent is like lack of information that you were provided with. And it's such a shame that we live in a day and age where most women, especially with their first baby and probably with their pregnancies afterwards, just don't know the information. And the argument of why the women aren't told the information probably stems on lots of things, like underfunded NHS and lack of training, lack of time. But like, before you're even in the situation of being in charge of that button, like everything should have been made clear to you. Everything. You should have been, and this is something so minor as well. So you're like, where does that end? Because that treatment of not being told and making sure you understand will spread across all parts of your care. So if, you know, having something could have, sorry, I know I'm falling over my words, but that could have been something much more serious.
Yeah, and I think when they do it, obviously you have to sign a consent form, and they read out the information of the side effects and what's happened, like almost like just like consent.
But you're almost half cut at this time.
Josh was literally like, can you look at her? She's not understanding any of this. She can't read that.
Yeah.
Like, I don't think you're really reading the room right now. She cannot listen. She cannot hear what you're saying or read this. Like, you're going to have to read it to her. I can't read it because I'm with her. I have no idea what they said. And it's like, you should maybe, if you're going through the induction process, maybe at this, I don't know, this is how I see it, maybe at the start, be like, these are the possibilities that you're going to have. If you have an epidural, can you just read the form now, just while you're...
Yeah.
Because at the start of the induction, like, it's very slow. Like, you're waiting around a lot. You're seeing if one thing works or not. And in that time, I'd rather them have said, right, we just want to cover everything just in case you need to have it. But this is what happened. Like, this is what happens with an epidural. Because you're in almost a bit of a right frame of mind at the start, I just feel. But when they gave Josh that pamphlet for me to read, he was like, can you look at her?
Yeah.
I literally had no idea what was going on. I was, like, Josh was having to hold me up because I was out. Like, and they're trying to get me to read this leaflet on an epidural. It's like, that's the wrong time to be asking for my consent, because I can't actually... Yes, I needed it. Not even saying no. I definitely needed that epidural. But I wish they would have told me when I was more in, like, more right frame of mind and actually could really read that information. Because I actually... I didn't really know that if you have an epidural, you're more likely to have an assisted delivery.
Yeah.
And I didn't know that, and obviously they would have explained that on the pamphlet. But because I was so not in, I didn't even know what was going on. I couldn't even tell you. I wouldn't have been able to speak. All I remember, like,
Yeah.
and Josh was so worried about me.
He wasn't taking it in.
He wasn't taking in any information. So I think that's where it's like, okay, maybe you should actually.
And why we need to advocate for ourselves in the first place, because, you know, this specific part of medical care is purely female care. And again, you can go into the argument of how, like, male and female healthcare are just treated with so much discrimination and so differently. It's crazy when you start looking into it. And it's like, but this is solely female healthcare, and there is no guidance, and that does need to change. But at the same time, with that needing to change, what will aid that change is if we enlighten ourselves, and we kind of have to kind of hold ourselves responsible, so that of knowing the knowledge, knowing the stuff, knowing about healthcare options to us, so then we can hold those in charge responsible too. Because if we don't know, like, if it's kind of like, if you don't have a birth plan at all, what you're kind of doing then is going into hospital and being like, well, I'll just let you tell me what I need, which I do understand. Like, I know for sure that with my first, and even still with Lily and with this pregnancy, that I want to be able to go with the flow of my body, and I want to do what's best for myself in the moment. So I don't have, like, a structured, like, this must happen.
Yeah.
But by not having any plan at all, I haven't gone away then and advocated for myself. I don't know, like, I might consent to something that I would never have consented to had I just known a little bit more, known a little bit better, because I've relied on people that I should be able to rely on to tell me the ins and the outs. But the reality is they don't.
No, and they don't. I find it really difficult because in one breath they say we can't tell you what you need, but we just kind of tell you what's available. But then when it comes to the bit of, no, you need to get this baby out, this is what you've got to do. It's like, okay, well, why couldn't you have been like that and been like, you're about to have an oxytocin drip. They literally said, have you thought about pain relief? I was like, oh, Gassinet, like, thinking I'll be fine.
Or even to say, most women have these experiences.
Would you like to get this?
These types of pain reliefs work for those experiences.
Yeah.
We don't know what your experience will be, but now's the time to start thinking about, if you follow this sort of pattern,
this is what's going to happen,
Like, where do you want this to lead?
Because I definitely feel like they said most women do get an epidural before they have the oxytocin drip, and I was like, okay, but why? You're not telling me why. Like, I'd rather them say, when you get the oxytocin drip, it's going to be very intense, this and this. We just say, like, a lot of people get the epidural because then they can control it a bit more. But because I was so far, I thought, oh, I'll be fine.
Sorry.
Do you need a breath?
No, I'm good. Sorry, I just had a drink, and as we all know, I'm struggling with that. Sorry, carry on.
I don't remember what I was saying now.
Oh, no. I'm sure we'll come back round to it.
Something about the epidural.
Oh, dear. Okay.
I think it was just more on the lines of, like, they told me that I think they were saying, like, oh, most women get this. They have the epidural before. But they didn't tell me why they get it before.
And then also, because that would have been the perfect time of being like, you know, your experience of an epidural should be like this, but it might be like that. And how do you feel if we do have to go down the assisted delivery route, and, like, letting you know those elements.
Yeah, because I feel like my birth plan and everything like that didn't really get discussed fully at all, really. Like, they were like, oh, have you done your birth plan, like, with all my midwives? And it's like, I feel like you should be sitting with me and being like,
going through it,
like, this is why, like, there's an appointment in your diary, like, go through your birth plan. That's what it says.
Yeah.
And I didn't.
And this is, again, why we should be, like, we need to advocate for ourselves. Like, I know it shouldn't be this way. We should be in a position where our NHS is in a position that it can support its staff to give us
that time,
the right treatment. But it's not. We all know it's struggling.
Yeah.
And that's where we really need to be the ones that walk into that room and be like, here is my birth plan. Let's go through it together. Do you have any questions about anything I've written?
Yeah.
I have these questions. But also, like, if you're not told that you need to go and do that because you're expecting
to have it through them,
it's just this vicious cycle of, like, women being left to the unknown.
Yeah, I think that's the biggest thing. It is women being left into the like, with little things like that. Like, I was like, I'm going to go with the flow. I'll be fine. Like, if I have to have this, I have to have this. But when I got on there, it was like a completely different story. Like, they just, they do let you almost decide. And it's like, yeah, but you're the healthcare professional. You're the midwife. You need to help me. First,
I don't
baby,
know what questions I need to be asking.
I don't know what I'm about to go through. You've dealt with this with a lot of women. Just tell me. And I was almost like, just tell me what I should be doing. That's what I need. And I still can't fault the midwives because they were still lovely, amazing.
There's definitely some bad midwives, but the majority of them are in that job. It's not an easy job.
No.
They're in their job because they want to be.
Exactly. And, like, I can't fault. It's just like, I would just wish I'd been told a lot more. Like, even when I first went in and they needed to put the pessary or something called the gel to start it all off the induction, the doctor said nothing to me. He checked me and I went, so am I dilating? And he went, after he'd finished, and he was like, oh, no, we need to start this. And I was like, so you didn't even tell me then, you were just going to finish with me and walk out, tell the midwife and walk out? That's not acceptable. And I'm not saying any of this.
It's just been in my vagina.
You're like, and I just feel like maybe I don't want to be, like, sexist or anything, so I'm going to be careful. Like,
he doesn't know what past history you've had with.
Exactly.
You know, and like, you're not, thank God. But, like, what if you were, like, a sexual violence victim, like, and all of that, like, if he's not said one word to you, how has he asked, like, well, the midwife might have, but did he actually ask you?
No, it was the midwife, like, are you happy for him to continue?
So you did consent, but as a person, like, you would just think, even though she's consented to this happening, I am about to perform something really personal. Maybe I should just be okay, Scarlett, I'm about to do this, just to give you the opportunity to be like, no. Even for his, it's just mental. It's just crazy.
I didn't have the best experience, I think, with the doctors. That we had one woman that came in and she was like, oh, you're one of my best patients because you're not causing any.
Oh, God.
I was like, oh, thanks for that. But she was the one doctor that actually spoke to me, like, fully spoke to me, engaged with me, like, proper. I think, and the anaesthetist, he was even better than half the doctors. He was explaining what was going on for me. But going, with the pain relief stuff, after
we digress.
Yeah, we did
a bit.
But going back to anesthesiologist, that is not the word.
Anesthesiologist.
Yeah,
you know what I mean. The anesthesia.
Yeah, that's it. That person. I actually think he was one of the best people I spoke to that whole experience. Like, I cannot fault him. I remember, like, he was the one that did my epidural, and I remember him saying, like, this is the one thing I remember. He went, I'm not going to do it if you're having a contraction, so let me know. And I was like, I'm having one. Like, and then all of a sudden I was like, I'm done. And then I woke up and went, like, that was, like, the only bit. And he came back to do my spinal, I guess, when I had, because I obviously had to go for an epidural. And I remember I was petrified. I just remember crying the whole way down to surgery. I was so scared. And he was like, it's all right. I'm going to tell you what's going on. Like, don't you worry. I've got you. I'm going to make sure you're not going to feel, because I was like, I'm going to feel it. I'm so scared. And he was like, I've got you. Don't worry. And he was the one, like, really trying to calm me down. It wasn't necessarily the midwives. It was him.
Yeah.
And I was like,
we need to create a space where these professionals are able to give that quality of care. Like, honestly, that should just be the norm.
Because honestly, they have that little cold thing, and they're like, can you feel this? And I was like, no. Can you do it again, please? Can you do it again? And he was like, I'll do it again. Because I remember being so scared. And then when everything happened to me after birth, no one was answering Josh's or I's question. Is that the right phrase? Anyway, and he was the one that explained to Josh like what was going on. And it's like, how can no one? I'm literally laying here with my legs open. You're working on doing something, and you're not even telling me what's going on. The anesthesiologist or whatever is the one communicating. Like, what? Like, I get the doctors are focused on what's going on because obviously they're like, oh my God, we need to stop this. But that made it sound really scary. They just had to stop the bleeding because I tore. But it's like, just be like, can someone just go tell Scarlett what's going on? Like, you are in my body right now, sorting me out.
That your midwife wasn't there for you in your ear, like helping you.
Yeah, say it's okay. They're just doing this. You've lost a bit of blood. You've taught none of it. And I don't know, that whole experience, I think, just didn't help anything.
Yeah.
There was some amazing people there, and I can't fault amazing. But there's people there that I wouldn't say they weren't amazing, but they just weren't communicating, and that's one thing I really needed in that moment, because I was blind to what was going, not blind, but I didn't know what was going on. But yeah, I think overall, just make sure you either I'm hoping this podcast will either help people who are about to have a baby openly and talk about these questions, find out information, and be able to advocate for themselves and say, what is going on, I need to know, because I need...
Especially when you're looking at pain relief, if you are already open to sort of the more medical side of pain relief as opposed to the holistic, especially if you already know that, just go out there and just know the details of what we want to do, and speak to your midwife as well, because I think for me, I definitely like to take more of a holistic approach. This time I'm I wonder how far I can go without any pain relief. And that, by the way, is not anti-pain relief, because if I'm in pain and I need pain relief, bloody give it to me.
When you said that to me, I was literally
I just see it as a bit of a challenge, and I feel let's see if we can get to number 10. I don't know. Right. We'll see. I don't think I will, but I'll use other elements that will be deemed as pain relief. So I'm going to use essential oils to aid relaxation. Water is my best friend. Has always been when it's come to period cramps. But even if I'm just feeling down, going and stand in the shower, sit in the shower, it definitely is something that's always pulled me out of a funk. So I will definitely be in the shower, lots of movement, and trying to use my body's own natural reserves of pain relief for as long as I can, aided by relaxation techniques. And I'm excited to try your wooden comb. Oh yeah, I haven't tried that before.
I remember using that,
and that's meant to be a bit of an acupuncture type.
Yeah, it is. I feel like
remedy.
I didn't get the chance to experience any of that, and I think I'm almost a bit I really want to experience that.
Yeah.
Which I want to experience that pain, but do you know what I mean?
Oh, it's almost what you're built for.
Exactly,
isn't it? As a raw woman.
Yeah. You're built to go through.
Thousands of women have come before me and done this.
Yeah.
Also, hundreds of years ago, a lot of them would have been the leading cause of death in females. So it's great that we have this medical care that can help women when their bodies aren't necessarily working in a way that they were meant for. So it's fantastic that we have this medical pain relief and these medical interventions. But if my body can do it, I want to feel it. I don't care if that makes me sound crazy.
No, I because now listening, I'm literally I can understand, because I want to feel that magical. I want to feel my body go through that and not be. But if
it comes too much for me, I am put me up.
Yeah, if my body, if that's the way my body works, and that's not, I'm never going to be able to experience that. But if I have to have a C-section, then that's just how my body.
Or if all your labours end in an epidural, that's...
It just is what it is. I say this as if if it ever happens again, I'm going to go through all birth with no pain relief. I'm going to feel it. I'm a wimp. So if that pain gets to me as well, I'm going to be oh, okay, what can I What can I take? I would
Yeah.
like to potentially not have an epidural next time, because I would like to feel a contraction and feel
Yeah.
it. But if it got and I know obviously heightened, obviously we'll talk a bit more about facts and in the Fact Friday. Sounded a bit about like epidurals and stuff like that, and like just a bit more information about them. But obviously they can lead to more assisted deliveries, and that's what I really would like to try and avoid.
Yeah.
I would say my options would be like either cesarean or natural birth. I would just completely avoid it if I can. Obviously sometimes you can't avoid it because if the baby's down too far.
Oh, is it instead of assisted delivery?
Yes, what did I say?
No. I was just getting confused because like I'm pretty sure that's the only way you can give birth.
No,
Like,
sorry.
natural or
Cesarean. Sorry, I mean
cesarean.
like not
But
assisted.
no, you're right that there is the elements of like being assisted and stuff.
That's the I just would like to not have that happen again, if that
Yeah.
makes sense. But it just is what it is. If that's what my body.
Little Finley's paved the way now, so
Oh,
hopefully
he is
that
fine.
helps.
Yes, hopefully.
Hopefully
His little
that,
big head.
Yeah, and I think they do say like statistics wise, first pregnancies tend to have a bit more of that intervention, like
Yeah.
induction and assisted delivery, and that also they all can lead on to one another. So as soon as you start an induction, that can increase your chances, and like you
Yeah.
said with the epidural, that can increase your chances of all those things. So even just maybe like if you're in a position where you don't need to be induced next time and having an epidural, you could still have an epidural and your odds might be lower.
Yeah, because I haven't gone through
Who
that.
knows?
Yeah.
But then that's what your like midwife that you see whilst you're pregnant is there for, is to
Mm.
ask those questions and find those bits of information out. And I was going to say as well, like something like when you get pregnant next time, I know you're quite set on the hospital that you want to give birth
Yeah.
in, but it might be worth when you are signed up to the midwife is finding out, because not all hospitals can do it due to equipment. So with epidurals, you could have like I think it depends on the anaesthesia you're given, but basically its effects aren't as strong,
Oh, okay.
which means that you can actually walk around.
Oh, yeah, see, that would be.
But the reason why not all hospitals can offer it is because if you do that with an epidural, you need fetal heart rate monitoring the whole time. So you need the equipment that allows you to walk around and be monitored.
Yeah.
And if they don't have that, then you can't have that type of epidural.
Yeah.
So that's probably something you should
Have a look into.
ask. I mean, it probably won't change where you're going to give birth, but
Just give
for
them that
some
option.
women it might.
Yeah, just maybe have a look, because every hospital has different trusts, and that's something to just, obviously, another thing, like when you are looking, like for the pain relief, if you want like a walking epidural.
Mobile epidural, I think
That's
it's
it, yeah.
called.
Then just have a look at your hospitals around in your local area, because they may be supported by different trusts, like the ones
Yeah.
by us. Technically,
And depending on what hospital you're giving birth at, depends on what midwife team looks after you
yeah.
prior. So your midwife team will know that or be able to find that information
Yeah.
out for you.
Oh, there you go.
Yeah, yeah. Save you doing that
Yeah.
leg of research. But yes, I'm just trying to think. I don't think I had any other type. I just had gas and air, and the pethidine with my first labour. Like I said, this time I'm going to try and go without anything. But I think realistically I'll be on the gas and air.
Yeah.
Like, I don't know. I got to 6 first time, got to 7 last time. I'll probably get to 8 and be like, yeah, that's fine. I beat my last score.
If you-
give me the gas and air.
If you do end up having a home birth, I'm gonna be like, come on, you can do
Yeah.
it. I feel like if you have someone
because I want to try and labour as much as possible in the water
Yeah.
this time, whereas I didn't at all with Lily, just because it all happened too quickly by the time I was going to get in the bath. Oh no, I did get in the bath when I came home,
Yeah.
and my labours popped as I got out. My labours popped, my
Your-
waters popped as I got out, and then they were running me a bath in. I remember this. The midwife was like, "So you can't birth in the bath because it's not the right format for you, but you can labour in it. It's fine. I can run you one." So it's like, if you feel like you're close to pushing, like we can't put you in the bath. And I was like, yeah, no, I'm nowhere near pushing. I was like, get me in that bloody bath,
Yeah.
because that's where I want to be. I
Yeah.
don't care if I have to give birth in it. But I didn't make it in the end. Like I knew that I was too close to
pushing.
pushing to get in the bath, that by the time it actually ran I was pushing, and obviously it worked out for the best in terms of what the midwife wanted, but in my head I was like, I don't care.
Yeah.
Like, I don't care if I'm
Neither.
not allowed. I want to
Yeah.
be in that
Just start running that
water.
bath just in case.
Yeah. So this time I've ordered one to be delivered here, and yeah, I don't think I want to necessarily give birth in the water. Like,
But
I'm
just
not
have-
fussed
yeah.
about that, but just being able to be in the water and
Just relax and stuff.
relax and be able to move my body when have the water take the weight
Yeah.
a little bit. But that's really all I've got signed up for
Yeah.
myself this time. But who knows?
I'm so excited for it.
Yeah, me too.
I feel like I'm going to be like, come on, you can do this.
Yeah.
Because I know how much you want to do it. So that's what, like with the pain relief and stuff like that. And like,
yeah. I think I will.
I think you will do it. I think you'll just be like, oh, okay, baby's there.
Yeah, I need to start getting on my breathing techniques and using my breath, I think, as my main form of pain relief and getting this baby out.
I definitely recommend hypnobirthing because I would say, yeah, it's a pain.
It's definitely a holistic approach to birth as a
Yeah.
whole, and it's not to say that you can't include pain relief if you want to go down the hypnobirthing route, because you can, but it's including it and using it to the best advantage to your body.
Not just, But yeah, that's the whole breathing and everything like that, so that will...
Yeah.
Don't know if you're just listening. I'm
Zen
Zen.
youth.
That's it.
Zen you.
Zen namaste. That's it.
Namaste. We'll see you next week.
See you next week.
That's a good
Namaste.
roundup.
Bye.
Namaste.
Namaste. Bye.
Thank you for joining us on this week's episode of Honey, I Birthed the Kids. We love sharing our own insights and experiences as parents, but that is just what they are. So if you're concerned by anything discussed today, speak with your GP, midwife or other healthcare professional. For more information about Honey, I Birthed the Kids, visit our social media platforms and website www.honeyiBirthedTheKids.com.